With any new technology, as we've kind of been talking about, we touched a little bit on implementation, but there's always the challenge of also ensuring that innovation doesn't widen the already present and very real disparities within our field. So, how do we implement digital tools in a way that's equitable, that's inclusive, especially for those of our patients who may have less tech access to technology or stable internet, etc.?
This is a really important question, and this is something that I'm very passionate about as well. Is everything that we do in our field, we need to be ensuring health equity. So can every patient access it? So I think about this in kind of two parts. One part is particularly for AI, we know that if there is bias in what we put into our models, there's going to be bias that comes out. So those of us who are creating AI models and using AI models, we need to ensure that as best we can, we're minimizing bias in the data that we're putting in. So I think that's one of the key components. The second piece is that I think AI is actually, or technology in general, is actually a huge opportunity to address a lot of the disparities that we see. For example, if we have patients who are in the rural setting and unfortunately are 2 or 3 hours away from a major academic center or a major health center, we know that it can be very difficult for those patients to be seen more acutely. Do we have opportunity for things like PA pressure sensors, for example, to come get that implanted, go back home, and then we have that really truly remote, very remote monitoring so that we can assess those patients from a remote standpoint and hopefully have better outcomes. The same is true, I think, for telehealth as well. Increasingly, we recognize during the COVID-19 pandemic that we can effectively care for heart failure patients who lived from far away. And so we need to ensure, and I think it could really close the gap if we do use technology. The flip side is, and as you alluded to, we need to do the best we can from a policy perspective to ensure that there's this foundational level of access. And that means simple things like internet, smartphones, those types of things that we know, unfortunately, too many folks in our society are not able to access. We need to make sure that there is enough equitable access, particularly if we're going to use these as standard of care models moving forward.
So, building on that, what role do clinicians and health systems play in making sure that technology enhances rather than replaces some of the really important parts of the patient and clinician relationship?
I think this is a really important question, and it's something that's very and dear to my heart because I just love that patient-clinician relationship, That's part of why I went into heart failure, part of why I went into cardiology. So I think no matter what, we need to make sure that the technology really just complements and supplements what we do and never kind of takes the place of that true relationship. When I think about equity, I also think about trust. And we know that patients really need to trust their clinicians in order to receive the best care, in order to be open to accessing the best care. And I think that requires a human to human connection. So it's something that we should never forget and never abandon, recognizing that that humanistic piece or that humanistic component of medicine is still the key, I think, to best care.
From a systems perspective, so what infrastructure or policy changes do we really need to get more specific? I know you mentioned this, but what are some of those changes in particular that we need to support this evolution that we're talking about, whether it's reimbursement for remote monitoring programs, integration with EMR, or workforce training to use these tools effectively? Where do you think we should really focus our attention on? Because there is so much that could be done.
Absolutely. I think one of the big challenges is when you have more information, it's like who is responsible for actually managing all that information. And so I think the more we can streamline the processes, the better we'll be able to actually effectively access these types of technologies. So what that looks like, I think, is, for example, for CardioMEMS, let's say you have PA pressures. Right now, at certain institutions, it can be very difficult and very clunky to actually access that. So, how can we streamline our processes to make sure that everything is in one place, for example, in the EMR that can be really easily accessible, that folks can review and in real time make management decisions? How do we streamline it so that when we make changes, that documentation goes in immediately to the patient and to other providers so that we can see the changes that we have made? I think what's going to be really exciting in artificial intelligence in the future is really automating that even. So not even requiring a person to make those minor adjustments, those tweaks to medications, but recognizing that AI has the potential to be able to make those tweaks and even to communicate with patients, I think is very, very exciting. And I think that's the future I see in terms of streamlined, EMR accessible, very easy and easy communication among the different team members. And I think we can get there.
So, as we wrap up, we'd love to look ahead. What do you envision over the next 5 years? What do you think technology will be the most useful for within heart failure in this recent next few years?
I'm really excited right now in terms of the opportunity for implementation. For example, we know that guideline-directed medical therapy works. We know that we have the four pillars. We know that we have the device therapy, but still, unfortunately, we know that we're falling short in terms of getting the appropriate patients on the appropriate treatments. I feel like that's the prime opportunity for technology to really help. We know that accessibility is still going to be an issue, so cost is still going to be there regardless of what technologies we have. But are there other ways that we can automate it so that patients who need it, whether they see a cardiologist or not, are able to get on the right medications, to be educated on the right medications, to have their questions answered? And right there, I'm thinking about AI chatbots, boxes, etc. So to have questions answered right at their fingertips so that they can know, why is this medication important? Why should I be continuing it, etc. So I think there's a huge opportunity to improve the implementation of all of the really wonderful therapies that we have. So I'm excited for the next 5 years to really dig into that.
That's great to hear. And I think it's so clear that at the heart of all of this, as we're talking about technology and innovation, is really the patient and the patient experience and how we can enhance that for them. So, with that, Dr. Youmans, thank you so much for a thoughtful and forward looking discussion.